The Toronto Academic Health Science Network, or TAHSN, employs individuals from diverse backgrounds, including members of religious communities who express their faith in visibly identifiable ways. For instance, Muslim women who wear the hijab, a scarf covering the hair and neck, Sikh men and women who wear the dastar, a turban, Jewish men who wear the kippah, a head cover, and Jewish women who wear a tichel, a headscarf or wig. After watching this video, learners will be able to facilitate the orientation of healthcare workers, demonstrate specific processes needed to scrub in for Muslim, Sikh, and Jewish healthcare workers with religious attire, and share resources to enhance further understanding of the specific processes. The purpose of this video is to demonstrate hospital practice standards for religious attire for Muslim, Sikh, and Jewish individuals participating in and/or working in areas with sterile procedures such as operating rooms or ORs. The goal of these unified practice standards is to balance religious obligations while ensuring the safety of patients and healthcare workers with appropriate infection prevention and control practices. Ajit is an ICU fellow of Sikh faith. He wears a turban, a kirpan, which is a small sword, and a kara, a steel bracelet, as part of his religious practice. He is about to prepare for a central venous catheter insertion, which is a sterile procedure. The steps he will take in order to adhere to aseptic practices for sterile procedures while also maintaining his religious obligations will now be demonstrated. These steps also apply to female healthcare workers of Sikh faith who may choose to wear a turban, kirpan, and/or kara as part of their religious practice. Ajit must secure his kirpan under his scrub top or hospital clothes in preparation for the procedure. Of note, for any surgical or other sterile procedure requiring the use of cautery, Ajit would need to remove the kirpan as it can pose a risk of electrocution to himself. Ajit's turban must be clean, laundered before each use, changed daily, and reserved specifically for use in areas with sterile procedures. It should not be worn outside these areas. All hair must be fully contained within the turban. The turban must be well secured, have no adornment such as beads or sequins, and be of a non-lint producing fabric such as spandex, lycra, polyester, or nylon. If Ajit's turban does not abide by the dress code policy for sterile procedures and/or is not reserved specifically for use in areas with sterile procedures, he must wear a disposable bouffant cap over the turban. The turban should be completely contained within the bouffant cap. In preparation for the procedure, all jewelry must be removed from hands and arms. This means that Ajit must remove his kara and keep it in a secure space, such as a hospital-provided locker. All efforts should be made by the institution to provide individuals with a secure space to store valuable religious items that need to be removed for sterile procedures. The kara can be placed back on the wrist after completing the sterile procedure. Ajit will need to cover his beard with a beard cover to minimize bacterial and/or hair shedding and to ensure sterility of the procedural field. He can use an ear hook mask extender to help secure the beard cover at the back of the turban. Of note, this also applies to Muslim and Jewish men who maintain a beard as part of their faith. Next, Ajit will ensure that the appropriate personal protective equipment is donned. This will include eye protection and a surgical mask that covers the nose and mouth. Ajit will then wash his hands and don sterile gloves and a gown according to standard sterile technique. After the procedure, Ajit will remove the surgical gloves and gown following standard sterile technique. This will be done carefully so as to avoid contaminating hands, arms, or clothing. Once Ajit has exited the sterile area, he can then carefully remove the beard cover and bouffant cap if wearing one and discard them into waste. He will then sanitize his hands. Ajit can now place the kara back on his wrist.